Okay, so this is the first of the practicals. So yeah, this is about anatomy, obviously. The slide isn't changing. Okay, so yeah, it's just going to summarize bones, joints, tendons, the spring mechanism of the fingers in the hoof arrangement, horn capsule, all that jazz. All right, so basically, it's very confusing. So I'll say that just in the course of evolution, obviously a lot of animals, let's say hand region, metacarpal region looks like ours, but like horses, they've kind of only kept their third metacarpal bone and it's like been reduced to like one finger. So what you basically have is like, so this is the metacarpus in a human, metacarpal 3, metacarpal 2, they've kind of fused in the horse, and then all you have is like the digits, so the phalanges of digit 3, so you have P1, P2, P3. So if you ever come across this even in the lectures, that's what that's on about. So the bone base of the finger, all right, let's do this one. Okay, so the bone base of the finger is phalanx 1, 2 and 3, and 3 of course is the hoof bone. It obviously looks like a hoof, and there are 3 sesamoid bones. You have the medial sesamoid, for example. I'm trying to find more. Yeah, there you go, you have your sesamoids here. And what else? The horn capsule covers only P3, obviously. You have the navicular bone on the ventral part of P2. So the navicular bone should be here, I think. And the bones of P1 and P2 are approximately cylindrical in shape. So you can see they have a very cylindrical shape, whereas P3, metacarpal 3, they have very characteristic appearances. So yeah, this is very confusing, so I'll just zoom out. So the horse's hoof bone has 3 surfaces, the parietal joint and solar surface. So the surfaces are shown here, I believe. So you have the solar surface. So this is like the part of the hoof that's going to touch the ground, and you have the parietal surface. So I think this is just the part that you can basically, I don't know how to say it, like stroke. And then you have, what was the third surface? Joint surface. Oh, okay, well that's obvious. It's sort of like this part, sorry, I'll zoom in, this part here where it's in contact with the joint. So anyway, yes, we have 3 surfaces. I'll try and show them all here. And in the place where they all meet, you get 3 edges that are formed. These edges form 2 processes, palmaris from the thoracic limb and processus plantaris from the pelvic limb. And then you have the hoof cartilage as well. Anyway, so yeah, these are just some things that we're going to touch on later. So some diseases are related to certain tendons in this area. So you have the deep digital flexor tendon. I forgot what this was, or did know what this was. So when you see DDFT and I have no idea what it is, yeah, just try and remember that that's what it is. You have the hoof wall, obviously phalanx 3, and the frog is very important. You can't see it well here, but it's the thing that's sort of triangle shaped. So there are 3 joints between the 3 main and sesamoid bones. So this is one of the sesamoid bones, and the 3 main bones obviously being all the phalanges and metacarpal bones. Yeah, so you have the fetlock joint here, which is made up of articularis metacarpophalangia. I'll show it to you. Articular metacarpophalangia, so you recognize the words. The pastern joint, which is made of articulatio interphalangia proximalis, here. And you have the coffin joint, articulatio interphalangia distalis, here. Anyway, so when you have the joint capsules, tendons, and collateral ligaments, the movements of these joints takes place on the sagittal plane. What does that mean? It means they just go forwards and backwards. And what else? I'm trying to find something to zoom in on. Let's give that a go. All right, so you have the undulate joint is made up of 3 bones. Let's go here. So you have phalanx 3, 2, metacarpal, I assume. Oh yeah, it says it here, sorry. I was wrong. Okay, so the undulate joint is made up of 3 bones, the hoof bone, P3, P2, and the navicular bone. So let me show these to you. P3, P2, and this is the navicular bone I mentioned, but you couldn't really see it before. So the joint capsule has 2 pouches. The dorsal, which is known as the recessus synovialis dorsalis, and you have the ventral, which is the recessus synovialis palmaris or plantaris, depending on the hoof. So if it's the forelimb, it's palmaris. If it's the hind limb, it's plantaris. And these are obviously the surfaces that are going to touch the ground. Now, why is it so important to know about these recesses? It's simple, really, because this is where we make our punctures for arthrotomy, so they are clinically relevant. And from the lower edge of the navicular bone, you have a ligament here, or here, I'm not sure, it's underneath it, called ligamentum impar, which ends on the hoof bone, which is obviously this. So yeah, oh yeah, so here it is, ligamentum impar. And in addition to being involved in a complex of these three things, you also have something called a spring mechanism. So this ligament is of clinical importance for this reason. When it's broken, it enters the hoof joint. And what it says is what you can do through it is perform a low arthrotomy. And yeah, it's part of the pathogenetic mechanism of navicular disease. Anyway, so you have digital flexors. I won't go into them too much because they're a bit complicated. But yeah, I'll just show them to you briefly. So basically you have the superficial contractor of the finger. Which is the musculus flexor digitalis superficialis. I cannot see it, sorry. You also have the superficial digital flexor. Oh, there we go. Yeah. So this helps the hoof go this way. Behind the fetlock joint. So when people say the fetlock joint, this is this area. And it forms a ring around the tendon of the deep digital flexor. So that's why it's superficial, because it goes over the deep, obviously. And yeah, the finger area is obviously divided into two branches, a stronger one ending on fascius flexura and a weaker one ending on the navicular bone. So we said the navicular bone's here. So basically, this limits the area covered by the navicular bursa, which is also called bursa podotrochlearis, which is why podotrochlearitis is sometimes what navicular disease is called. And you also have the common synovial vagina of the contractors distally, so this way, which reaches the navicular bursa and proximally to the middle of the metacarpal or metatarsal bones. And yeah, don't get too bogged down in the anatomy. This is purely just to help you, not to learn for the exam, hopefully. So yeah, you have bursa podotrochlearis, the navicular bone, and the two branches of the deep flexor, and they're united in a common anatomical and functional complex called what we call the spring mechanism. So yeah, just to reiterate, you have the bursa trochlearis, the navicular bone, so the little bone underneath here, and the two branches of the deep flexor. So you have the superficial and the deep. These form the spring mechanism. When one of the components of this mechanism is affected, the other components are usually included in this process. So when we talk about navicular disease later, things like that, you'll notice things like deep digital flexor tendon and things like that, and you'll see how they're all interlinked. In ungulates, so obviously animals that move the way I explained, there is one extender tendon, the common digital extender tendon, and it comes from musculus extensor digitalis. It says it's about 2 centimeters wide. This is important for when you're doing surgery. And it also receives tendon fibers from musculus interosseus medius and ends on the processus extensoris of the hoof bone. But don't worry about remembering everything. Don't get too bogged down. Okay, I'm going to end here and we'll continue from here.